Hey everyone, today we're going to discuss upper motor neuron disease and lower motor neuron disease and how to differentiate between the two classifications. I'm going to discuss or reference my Score Builders flashcards again. So let's start with upper motor neuron disease. The flashcards define upper motor neuron disease as a lesion found in descending motor tracts within the cerebral motor cortex, internal capsule, brainstem, or spinal cord. I'm going to review the terms in bold in future slides, but I want you to think about how upper represents the higher central nervous system structures. Symptoms of upper motor neuron disease include muscle weakness, increased tone or hypertonicity, hyperreflexia when testing deep tendon reflexes, mild atrophy from disuse, and abnormal reflexes such as a positive Babinski sign. In the definition of upper motor neuron disease, the terms descending motor tracts and internal capsule were used. Think of descending motor tracts as the pathways which send motor signals away from the brain to lower motor neurons. These pathways include both pyramidal tracts, which are under voluntary control, and extrapyramidal tracts, which are under involuntary control. The internal capsule is a structure within the brain that connects ascending and descending tracts of the cerebral cortex to the subcortical structures as well as the brainstem and spinal cord. And here I've included a picture of the internal capsule for reference. The flashcards define lower motor neuron disease as a lesion that affects nerves or their axons at a level below the level of the brainstem, or usually within the final common pathway. The ventral gray column of the spinal cord may also be affected. Symptoms of lower motor neuron disease include flaccidity of muscle or muscle weakness, decreased tone or hypotonicity, fasciculations, significant muscle atrophy, and decreased or absent deep tendon reflexes. In the definition of lower motor neuron disease, the terms final common pathway and ventral gray column of the spinal cord were used. I'll define these terms to ensure you are clear about their meaning. The final common pathway is the alpha motor neuron that forms the terminal step of one or more reflex circuits ending with the desired end organ. The ventral column of the spinal cord is also called the ventral horn of the spinal cord. It contains motor neurons that exit the spinal cord to innervate skeletal muscle. I've added a picture of a cross-section of the spinal cord for reference. I'll end with a summary slide that is also a mnemonic. The mnemonic is Storm Baby. As you can see, all of the arrows point down in the lower motor neuron column, and almost all point up in the upper motor neuron column. Note that the other row stands for fasciculations, fibrillations, and clonus, which are present in an upper motor neuron disease, but not in a lower motor neuron disease. Additionally, the arrows in the Babinski sign row refer to the direction in which the toes point. The toes will point up in an upper motor neuron disease, indicating a positive Babinski. The opposite is true in a lower motor neuron disease. If you like what you see, please check out my other videos and like and subscribe to support this channel.